September 28th is World Rabies Day, bringing an awareness to this fatal but preventable disease. Dr. Amy Guernsey with University Veterinary Care Center is here to tell us more. Good morning.
Good morning.
Let's start with what is rabies?
Rabies is a virus. It exists in wildlife and reservoir species such as raccoons and skunks and bats. It transmits through either saliva or neural tissue. If a human or one of our pets gets exposed to it, it travels to our central nervous system and causes a lot of damage, more often than not. In fact, almost 100% of the time causing death.
It sounds pretty scary. Is it common here in our area?
Not nearly as much as it used to be. Globally, rabies still kills thousands of people every year, mostly because third world countries deal a lot more with feral dog populations. There are not rabies vaccine programs in place. In the United States, we used to see about 100 deaths per year up until about 1960. That number dropped dramatically with the use of vaccinations. Now we only see 1 to 2 human deaths per year, which is still very sad, but it's a dramatic decrease. In Kansas, the CDC reported 40 animals tested positive for rabies. The vast majority of those were wildlife, but there were still a handful of domestic species in that categorization.
Well, which of our pets are most susceptible to getting the virus?
All mammals potentially can get it. Your dogs, cats, ferrets, horses, cows, they can all get it. So that's why vaccination is so important.
And what if my cat is indoors all the time? She never goes outside.
Great question.
Should she still get the vaccination?
Yeah, absolutely. I get that question all the time. Sounds like a very far-fetched scenario, but just because your cat doesn't go outside or you try to not let it go outside doesn't mean it can't someday get out. And then the other possibility is for wildlife to come to you. People think that that's kind of far-fetched, but I personally have had to remove 3 bats from my home, one of them out of the mouth of one of my cats.
Oh, wow.
So I was very glad that that cat was vaccinated because there's risk of exposure even for indoor cats.
Well, let's talk about the vaccination and the best way to prevent the virus.
Sure. So we usually vaccinate animals around 12 to 15 weeks of age when they're young. We booster that annually, and then it can be spread out to every 3 years as a booster.
Okay, well, Dr. Guernsey, thank you for being here with us this morning. And if you would like more information about University Veterinary Care Center, head over to universityvetcare.com.